So our next presentation is from Sehat Kahani. Sara will be presenting. So it is another company which is doing, extremely well with its telehealth platform that aims to, democratize access to quality and affordable healthcare using cost-effective tech-enabled solutions through a network of qualified, home-based female doctors. So, thank you for taking on the time, Sarah. If you can just, share your screen and share with us your presentation, and we can start then.
Sure. Assalamu alaikum, everyone. Thank you, Ali, for the very, very kind invitation to the event. Pleasure to be here back. I'm going to share my screen. So let me know if you can see it.
Yes, we can see a screen.
Great. Just give me a minute.
Before Sara starts, I thank you, Sara, for joining again. During the when COVID started, Sara was kind enough to give some time for joining our webinar to talk to our clients about the COVID situation, how bad the thing is, and what should they do in order to deal with it. And that was very helpful, Sara, and extremely insightful. So thank you for coming again, and this time talking about your company.
No worries. It was a pleasure then. I think we were all in a lockdown and pretty controlled situation, unlike what we are in right now. So I hope everyone is safe, everyone is healthy, and everyone is staying safe and taking precautions. Furqan is a very tough act to follow, but I'll try my best to provide a little information about the company that we've built. Just a formal introduction of myself. My name is Dr. Sara Saeed. I am the CEO and co-founder of a company I run and have co-founded in Pakistan called Sehat Kahani. I'm a medical doctor by profession. I was a radiologist in past life. I didn't like it, left it. I am a public healthcare specialist. I've done my master's in health policy and management. And generally, healthcare to the last mile excites me, along with having the right policies and regulations that can create compliance and accountability. So a little bit about Sehat Kahani and how we started. I'm a female doctor, and one thing that all of you might relate to is the term doctor bride in Pakistan. And it's a specific term which is very interesting for our country because we live in a population which has around 200 million people. We all know that. But an interesting fact is 50% of our country never sees a doctor in their lifetime, which means they might be going to a quack or a midwife, but they are not going to a real doctor. And that makes Pakistan 154th out of 195 countries in terms of accessibility to healthcare. And of course, women and children in this picture are most tarnished. So, 36% women in Pakistan still deliver at home. 1 out of 5 children do not see their 5th birthday. And a very interesting second problem that somehow multiplies this number is Pakistan's issue of a lot of doctors going missing. So Pakistan has around 200,000 doctors, which is not that bad. That means we have 1 doctor for 1,000 people in the country, which is the WHO minimum standard. Where it's get interesting and a little complicated is that 60% of this workforce is female doctors, and it's only increasing with time. However, only 23%, 1/4 of this number actually works. We lose additional 12% doctors because they go to outside Pakistan for better work opportunities. So now what Pakistan has is 1 doctor for 1,700 people in the country, which is an extremely devastating number. But even what's more worse than that is 85% of our doctors live in urban area and only 15% travel to the low income area, which is where majority of our population works. So this unequal supply versus demand issue does not make sense at all. But something that makes sense for Pakistan, and something which is a silver lining, is we've done pretty great in accessibility of technology in the country, especially internet penetration. So we have 85 million smartphone users, we have 36% internet penetration. And what we can do is, and what we do in Sehat Kahani is we combine the problem of patients not getting healthcare to women doctors who are sitting at home, combining two together through the power of technology. In healthcare, we use a technology called telemedicine, which is connecting the patient to a doctor on a virtual call or an online call or a telemedicine-based call if they can't meet each other physically. So that's exactly what we do. We connect an untapped, underutilized resource and pool of female doctors to patients who need healthcare using a telemedicine-based solution. The solution is available in two forms. So when we started the company, I actually am a huge believer that healthcare should be accessible to all. So we started providing healthcare in low-income communities first. The initial idea with which the company started was that there are a lot of clinics that are run by nurses or midwives or health workers created in different times in different segments in Pakistan. They're running independent clinics, they're treating patients, they're probably the only source of healthcare in their communities. So we walked to them, we said, you're doing a great job, but let us make you a better healthcare provider. So we gave that nurse training on telemedicine, we trained her primary healthcare protocols, we upgraded her clinic, made it nice and pretty. And then we connected through that nurse patients that came into that clinic to an online doctor that can be placed anywhere in the world. And while we were making these clinics and while we were growing the company, we realized two things. We realized that in every clinic, we're just empowering two doctors because you have to create relatability for the patient. And also we're only covering 5 kilometers of a community, very important that 5 kilometers, but the mass, the scale of the problem is not being met. So in 2018, we started making our telemedicine mobile application that today connects any patient who wants to connect to a doctor without the nurse in less than 3 clicks and under 60 seconds. Because when patient, and the inspiration for this under 60-second came from our clinics, because when a patient walked into the clinic, the nurse connected the patient immediately to the doctor. So there was no waiting lines, there was no travel for the patient. And we carried through the same philosophy on a mobile application. So now we have two verticals. For low-income communities, we still create telemedicine clinics. And for the masses, we have a mobile application that can be used by individual consumers. And we also created another twist in which we provide this solution to corporates to ensure all their employees for outpatient coverage if they don't have an existing policy that takes care of that. Because in Pakistan, a lot of corporations provide inpatient coverage to their employees, but very few provide outpatient coverage. So this is a cheap alternative, cheap but cost-effective and quality alternative to that. So what are the benefits we provide? We provide access to general physicians and specialists and mental wellness specialists also, something which is very close to our DNA, that health is physical and mental. We create a digital identity of every patient. We provide an e-prescription in our clinics that get printed, and on the mobile app, it can come in your mobile application. And we provide various value-add services as well. So in the clinics, the patient can access online a weekly lab collection or a weekly ultrasound service. And on the mobile application, you can order your pharmacy at home through our partners, as well as you can get your lab collected at home through our partners as well. If I just talk about the patient journey, so when a patient walks into a Sehat Kahani clinic, a low-income beneficiary member, they get a nurse who's sitting there, she connects the patient to a doctor, the consultation happens, the patient gets a prescription, they can access the value-add services, and if the patient cannot be seen through telemedicine, we refer the patient to a tertiary care center with a referral letter in their hand so that they don't have extra trouble. On the mobile application, things are a bit different. So if you're a mobile application user, we can make our own profile. We can search a doctor based on our symptoms, specialty, or expertise. When you do that, you see a list of doctors available there and then for a consultation through a consult me option. You pay and you can get consultation done. At the end of the consultation, you get a prescription, which can come in your email and can be available in your mobile phone as well, which can be taken through any pharmacy, and you can get a medicine on that. So what have we done so far? We have a network of 30 clinics across Pakistan, the largest by any private provider in telemedicine. All these clinics are enabled by nurses, and doctors are connected from all over the world in these clinics. Our clinics run from 9 in the morning till 10 p.m. in the night. We are working with 45 corporate partners who are using our application today in Pakistan, providing healthcare to 120,000 plus employees. We've done around 300,000 plus consultations. We've seen a big boom in telemedicine post-COVID, and we've created a revenue of $550,000 till date. How does the patient pay? So in our clinics, the patient pays fee per user. on the retail application, which is an individual consumer application, they can pay as they go per consultation, or they can pay through subscription plan. And corporates usually pay us by an annual subscription plan, which is based on the number of employees and the number of services that they're using. We have 1,500 female doctors in the network. When female doctors, and this is a question I get asked, जब थोड़ा सा gap आ जाता है, तो how do they provide consultations? Don't they lose their knowledge? So when we bring them back, we pass them through an LMS, which is a learning management system. They get a revision, a crash course of all the protocols in primary healthcare, which are common in the country. They have to pass that. And once they pass it and they comply to other quality assurance protocols that we have, they become a part of the network. And from time and again, we take our doctors from this network to activate on our app as well as on our clinic. So we have around 350 doctors from this network who are already active, earning money through the clinics and the app. So COVID came at a very interesting time when we had the clinics, but the app was pretty new. So our app got launched in late 2019. So our app was 2 years old when COVID started, and we had a very stable network of clinics, 27 clinics. And on March 20th, when lockdown happened, our clinics got shut down and we had a new app which had like 50 to 60 patients coming in a day. But I think the good thing was we had a solution ready. So it got picked up by the federal and provincial government in Pakistan. So we worked with the federal government as well as the Sindh government to provide healthcare to patients in COVID-19. At the same time, we were able to create an accredited course for female doctors in collaboration with Ziauddin University. And we were also able to create for the first time a subcommittee on telemedicine with the Pakistan Medical and Dental Council. So all of this momentum helped us provide 65,000 consultations during the COVID-19 wave, all free of cost, with a follow-up mechanism on the 2nd day, 7th day, and 14th day, just to make sure that we're not losing the patient. We also increased our network of clinics to 27. Now we have 31, and we are progressing to 40 clinics, inshallah, by the next 2 months. Our app got picked up by 43 corporates in Pakistan. We had 2 already. Now we're working with 45 corporates across Pakistan, which has some of the very large names. So we work with Mizan Bank, HBL, Jazz, etc. We provided a lot of general counseling consultations, issues that people can get solved at households, but we provided 26% specialist care as well. And around 10% of our patients had COVID-19, and they were counseled, as I said, on the 2nd, 7th, and the 14th day. Not only that, the app was used 6% during this time and even now by patients who are outside Pakistan, primarily the Pakistani diaspora, who is also under a lockdown, needed a Pakistani doctor or a similar language-based doctor to talk to. We had consultations from America, Canada. We also had some consultations from India as well, which was great to see. Something that I'm very, very proud of, we also worked with the government of Pakistan to create the first tele-ICU project, which means that our app twisted between now that was previously used doctor to patient in 60 ICUs across Pakistan can be used by junior doctors to connect to senior doctors who can advise them for critical care. And a little perspective on that Pakistan only has 70 critical care consultants, and only 20 of them are actually at the consultant level. So rest are senior registrars. So this allows 10 extremely experienced consultants to work in 60 ICUs through junior doctors, providing care in the COVID time. We've already implemented 45 of these ICUs in public and private hospitals in the country. We also launched, because we realized that not all patients have access to a smartphone. We also launched with Lifebuoy and Unilever, a mobile helpline that allows a patient with a feature phone to just drop a missed call and the system calls them back, and they can get consultation with an online doctor as well, this time through a feature phone. So what are we doing next? We're raising around $1 million. We've done 60% of it. Our next 2-year vision is to get to 48 clinics, work with 100 corporates plus, and impact 2.2 million lives. We are still raising around 60% of it is complete, 40% is remaining. We imagine that we will reach to 1.8 million users by 2021, increase our network of doctors to 5,000 doctors, and work, as I said, with 100 plus corporates to make sure we're providing good quality healthcare. In terms of our team, this is me, this is my co-founder, and we have an advisory board, which is made up of 8 people. In terms of revenue, we've made around 550 till now. We envision to make $7.2 million by 2023. These are great partners or supporters that we work with. Some of the interesting things that have happened. So I am a Cartier Women's winner. I'm an Acumen Fellow. I've recently gotten the Bulago Fellowship as well. We've had a lot of amazing documentaries made of us, a lot of honors that we've gotten through our work. But something that we keep really close to our heart is we're the first company the Islamic Development Bank has invested in, the first Rolex Award winner in the company. We've recently gotten the Elevate Prize by MIT for our work in COVID-19 and beyond. This is our funding cycle. So we've had the opportunity to work with a lot of funds and grants and investors because we're a social impact fund. So as I said, we've raised around $500,000 and we're right now raising around of 1 million pre-money through investors and donors. And recently we got mentioned just yesterday in The Economist. So very happy about that. That we got a very small but significant mention, one of the health firms who've done good work in COVID-19. I think the big vision that the company has is I'm a doctor. I have no background of business. I'm not proud of that, but I've built something out of passion and a lot of hard work and a lot of trials and errors. And so our big vision is that we stay around for the next 10 years, bring back 50,000 people, 50,000 doctors to the workforce, impact 25 million lives, and become that telemedicine provider in Pakistan that scales to other economies that have similar healthcare concerns through the hybrid model that we have, that are clinics as well as our mobile application. Thank you. That's about Sehat Kahani and me.
Thank you for that great presentation and for all the wonderful work which you're doing in terms of helping people's life, especially during COVID times. And congratulations on getting that mention on The Economist.
Yes, I'm absolutely very excited about that.
Definitely to be proud of. I love those numbers which you had in terms of your targets for 2021, and I think there was a number that 1.8 million users for your app. How many do you have right now? So what kind of growth are we talking about, and how was your growth in 2020?
So I think we saw, so as I said, we were going, so we had like 50 to 60 people a day using our application. That bumped up in 2020, especially in the COVID first wave, to around 1,000 patients a day. Now we are holding steady at around 500, 600 patients a day. Because we have 3 streams of business in terms of clinics, in terms of corporates and app, I think we have 3-fold element to go. And I think our clinical business has really boomed because a lot of patients now realize the value of having a qualified doctor in their community rather than going to a tertiary care center, which is risk. So we do around 25, 30,000 patients a month. We're growing that. We're building a marketing strategy to make sure we reach that 1.8 million number. Something very interesting that we've done, which makes me really happy, is that we've not only kept our mobile application, our clinics, but we've also provided a white label version to some of the existing applications that exist. So if you go into your HBL application in the health segment, you'll see a Sehat Kahani mobile application, and HBL has around 1 million users. And we already have 65,000 people who are our users through the HBL app. And then we are putting the same in Alphala and many other banking apps as well. So this will give us an enormous opportunity to boost and bump the consultations that we have, not only through our platform, but also white labeling through other platforms as well.
Absolutely. That's a wonderful strategy. And in terms of revenue model, how do you charge? How does that work?
Yeah. So in terms of the clinics, it's fee per user. We charge 50 rupees for the services because these are based in extremely low income areas where there are no physical doctors available, rather than quacks. So we generally compete in quacks in the area. We're charging 25 to 30 rupees per consultation. So we have to keep it competitive. In terms of the corporate applications, a very simple annual subscription model multiplied into the number of employees you have, number of families you want to ensure, the services that you want. So we have tariff-based services. And in terms of the retail application, the patient has the autonomy to pay per user or per subscription. So it depends how they want to pay. So these are the three ways that we create revenue. If you're white labeling, we generally do it through subscription plans so that patients can pay one time for an yearly or a 6-monthly or a quarterly service.
Wonderful. So we are open for questions. For people who have questions, please put it on chat, and my colleague Talha would moderate the session. Sara, your presentation was so comprehensive that I usually have a lot of questions, but your presentation had already had a lot of them. What have been your biggest challenges so far?
I think we work. There are a lot of operational challenges, but I think with time we've realized that the only way to solve them is actually to do it, to learn, to fail, to rise again. I think the biggest challenge that I see now for telemedicine in the country is that we don't have an official regulation or policy for digital health or telemedicine. In every country who has had a boom in telemedicine or digital health has had a policy and regulation and best practices that good players comply to and pushes the bad players out. But here we see that everyone is coming in and there is no accountability or compliance in something as big as telemedicine that can eventually play with the patient's life. So I think that is one challenge that we are working. We are trying our hold on everyone at the public healthcare level to make sure that we get a policy. In Pakistan, health is also a devoluted subject, so provincial and federal work separately. Anything that it is administered in one province does not have to be in the other. So you have to fight the battle 5 times rather than one. So that I think is a bit is the current challenge. I think fundraising has been a challenge because we're a social impact company. So we have a social impact arm and a revenue making arm that is pretty new. But I think generally in terms of the ecosystem, funding has opened up even for a company like ours. So it depends. If you're good at fundraising, if you're good, I think there is money available now. So that challenge has resolved. So my biggest challenge is policy.
Very interesting. And what about your company? You mentioned some of your colleagues in terms of your team. How many people do you have? How are they divided between different roles? How many people do you have in tech? Is your tech in-house or have you outsourced it?
Yeah. So we have around a 220 people team now. We have around 40 people in the head office. We have a 15 people support team. We have around 70 people in the communities because each of our clinic is manned by a clinical coordinator. And we also hire female mobilizers in clinics where we feel that the traction is less so that they can educate people about telemedicine and bring them in. So our Facebook or WhatsApp in the communities is that female mobilizer. Then we have an 8 people tech team. So we initially got our technology made by 10 pearls because I'm a medical doctor, so I had to find the best people in business to find the app in me. They also are investors, but now we've moved it in house. It's managed by a technical manager and 8 people team, all in house. So 220 people as of date.
Wow, that's amazing. That's very well done. Talha, I think the question's coming in. Do you wanna?
Yeah. So there's a question from Richard. Actually, he has 2 questions. Number one is, how do you measure your cost of implementing and marketing a platform with regards to the impact generated? So he has mentioned a metric that people that get access to a doctor divided by the number of dollars spent running your company. So this is the first question. The second question is, how do you work with a peer-to-peer network effect? So the users market it to new users, to increase the impact with some operations or marketing costs. So
yes, I think we generally have a customer acquisition cost and strategy put in place on the amount of money we spend to acquire customers. In the clinic, obviously it's different because we are putting human resources in to get the customer in because we have a female mobilizer. If it's a corporate application, that's amount of numbers and hours spent from deal generated to deal closed and how many employees, their man hours, time spent in closing the lead. We normally try to keep it within 45 days as of now, because selling a telemedicine solution to a corporate is a difficult challenge. And of course, on the retail, it's customer acquisition against the marketing that we spend. So every revenue vertical has its own acquisition cost. But it's generally lesser for the clinics. It's highest for the corporate clients and average for the retail customer. In the clinics, we have a 33% net profit revenue rate, and on the app, we have around a 56 to 60% average revenue rate right now. I think that answers both of your questions.
Sarah, what about the impact generated? For example, the people that get access to your to a doctor through your application. So, do you guys have any do you guys measure this key metric?
Yeah, of course, impact I think is very important. Every patient consulted is an impact. So what we do is we have a feedback mechanism in the clinics as well as on the mobile application. So what we do is when we close our clinics, we do a random sampling, an audit of how the customers were served from the doctor's perspective as well as from the patient's perspective. So we do an audit for all the doctors for quality assurance, and we also use our call center to call patients back and take their feedback. So we have a 7-question questionnaire that we use, and from there we tabulate how successful were we in providing quality care in our clinics. On the mobile application, so one thing that we did when we started our app for COVID-19, because we were very new, we knew that we're going to have some bumps and hiccups and some operational challenges. So one thing that we did was, for every patient who called to Sehat Kahani, we gave them a call back. And we asked them their feedback. We had a 5-page questionnaire that we follow today, and that gave us some immense insights on how to make our app better. My app in February 2019, and right now there's a world of difference in how it works. And that only happened because we called each person up and मैंने कहा क्या अच्छा लगा, क्या बुरा लगा, क्या समझ नहीं आया. So we still do that, and from there we get the metrics that what is it that we're doing good or bad, and of course that all tabulates into the impact that we're making. And of course, for us, the impact is how successful was a consultation for a patient and how did they feel after the consultation as compared to before the consultation, and how did we make healthcare better for them, which is something that we know through follow-up consultations. So we also know that how many patients come back for a consultation if they ask for, at least for the first time you started that. So we have very accurate numbers on seeing first-time follow-ups and how the patient journey has changed in terms of medical healthcare.
Great, wonderful. So there's another question from Stuart Bennett. So what you are doing to log in your current doctors in the platform, in terms of time, commitment, and or exclusivity. He mentions that since there is emerging competition and in other markets, this has led to a race to a bottom where doctors are encouraged to move platforms from offering them more money, and then margin is squeezed. So what do you have to say about this?
So I don't believe that healthcare should be exclusive. We don't limit our doctors from working on other platforms. I think for us, this hasn't been, I don't know about the other telemedicine platforms, but with us, because we work with a female-only telemedicine platform where females come back after a break, or maybe they're working part-time or come back, I think they feel more associated to the platform. They get more association from the community. So it's just not an app that they're working on. It's a community where they get access to information. They get access to CMEs, they get access to any new trainings who are coming in. So that keeps them motivated. On top of that, they get a revenue share or they get a stipend depending upon where they work. We do ask them to disclose if they're working on any external telemedicine platforms, but there isn't exclusivity at this stage. We've had a very, very low attrition rate in terms of our doctors leaving. It's under 2%. One of our first 2 doctors who joined us in 2016 are still with us. So I think what keeps a doctor committed to the platform is A, because we give a sense of a community that's empowering female doctors. B, we have a team who listens to them, supports them. So just not a vendor providing service, they're actually part of our network. And C, because they see growth opportunities and flexibility. So, if they want to work 3 hours a day, 5 days a week, if they want to work 2 hours a day, 3 days a week, if they want to work 7 hours a day, 7 days a week, that all is possible on our application. It's actually a toggle that they have to push on and off. So if they push it on, they're active on the platform. If they push it off, they're inactive on the platform. So they can work according to their flexibility, which keeps them in. But I think if they are available at multiple platforms, I think it's good for the country. It's good for the community because they earn more money. We get more doctors working on telemedicine and patient gets more access. So I think that's a good thing.
Okay. So I just have one question. What about affordability? So you mentioned in your slides that individual consultation costs around $1 to $3, right? So if you are catering to the lower masses, so are they able to afford this at this rate?
So I think in terms of our clinics, which are based in low income communities, they actually start from $0.5. We actually charge 50 to 80 rupees for a consultation. $1 to $3 is for the retail application. So normally our services in the clinics are ranged from 50 rupees to 200 rupees, depending upon the GP or the consultant. And on the app, they start from 250 rupees for a GP, which is extremely subsidized compared to a physical GP, and go up to 3,000 rupees for a psychiatrist, psychologist. But we also have subscription plans for people who want to do a bulk purchase. So for example, in 999, you get unlimited consultations for a year. And that I think entices more people to use the service. So it is at least 50% more cost effective than a physical consultation. And we've kept it this way very tangibly so that people try it and people get used to telemedicine and showing to a virtual doctor. Obviously, there's room of growth and more profit margin, but we're in a very new nascent domain in Pakistan now. I think before COVID, जब आप किसी से बोलते थे कि वीडियो पे डॉक्टर को दिखा लो तो वो देखता था कि क्या हो गया यार, मतलब नब्ज नहीं देखेगा डॉक्टर तो इलाज कैसे होगा. And now I think we've opened to the idea कि अच्छा चलो सही है, वीडियो पे भी डॉक्टर देख ले तो इतनी बुरी बात नहीं है. So we're crossing that bridge. So I think right now prices are catered to make more people come in than keep them out.
So Sarah, on that point, there's a follow-up question from Richard, and I'll combine that. And you were just saying that that now prior to your platform and prior to COVID, and then telemedicine was not really, people did not think that it could be legit as a proper medical experience, but now people are using it. So that's a major impact which you're having, that you are making people adopt a new model of healthcare delivery. Do you think about what's the overall impact which your company is going to have? And is there any way that you can measure it? So for example, you're having an impact on the doctors, the female doctors who were not working, staying at home. Now they're contributing, working, earning. B, you're having an impact on the healthcare outcomes. People are now, it will become easier for them to get access to doctors. C, there's also an impact from a gender perspective that often women don't feel comfortable in even going out to clinics and finding, it's rare to find female doctors. It's very difficult to find female doctors for everything. So do you measure this, or do you have plans of, do you think about a framework to measure the overall impact which you're having?
See, I think in terms of growth, I sincerely believe, and this is no hidden fact, that Pakistan does not have and will not have enough doctors according to the population that we have. So we are 1 out of 1,700 right now, and this is only going to get, the gap is going to widen because the population is increasing and we're not creating as many doctors, and we're not containing doctors as well. So we are creating a good number of graduates. We're not doing anything about the female doctor issue. We're not getting anything about the brain drain. So we have a steady number leaving every year. We have a steady number opting out. So I believe that the long-term impact that telemedicine can have is replace primary healthcare or add to primary healthcare in the country, because we have limited number of doctors, we have more patients, we have an infrastructure that can support telemedicine in terms of internet connectivity, and it's only increasing with time. So I think the longer term impact and the longer term question that I ask as a public healthcare provider is, can we replace a physical doctor through a telemedicine doctor at primary healthcare level? And in Pakistan, healthcare, and especially primary healthcare, should be given by the government through the basic healthcare units, through nurses and community health workers available. But the only reason that doesn't happen is because in those healthcare units, doctors are not available. And those nurses and community healthcare workers don't have the expertise to provide healthcare in their communities. But can you connect them to a doctor through telemedicine in those basic health units, through a mobile application? Can you give that access to a patient in their own hands? So the longer term impact that I see is replacing a physical doctor through a virtual doctor in primary healthcare. That's a long-term impact I see as Sehat Kahani, and that's why we work on a hybrid model in terms of clinics and mobile application to see how far and how beyond we can provide healthcare in a country like Pakistan at primary healthcare. In terms of measurement, we right now measure the satisfaction, the customer satisfaction rate with respect to the consultation and respect to our compliance to our medical protocols created in the first visit, second visit, and the third visit. So that's what we know, that how did we significantly improve a patient's condition between these 3 visits, and what made them come back? Because a lot of patients in primary healthcare do not feel the need to come back for a follow-up consultation, and then we can't know if they're feeling better or not. But how can we create that loop for feedback? So I think on a longer term vision, and even right now, a big focus into connect that patient to a qualified doctor rather than the quack, and really noting their follow-up consultation to see how we are changing, or how we are making, or how we are increasing the quality of life for patient up to 3 visits. That I think is the focus of the company.
Great. No, thank you. I think you're doing a great job, and I will certainly download your app and register on it. And certainly, if we at KSB, we would love to consider like offering it to our team, because I see the value. And as somebody mentioned, such models are getting adopted in other markets as well. In the UK as well, there's a company which now is signing up a lot of corporates, and they are giving the product to users. And it's for me, the biggest thing is convenience. Like getting a time from a GP is pretty tough. So if you can get that time digitally without going, especially during COVID times, and that's such a big blessing. So I'll certainly.
I'll just add something here. I think we've had a lot of corporates who've signed up, and word travels from one corporate to another. So the only thing that is struck in people is that whenever a patient needs a doctor, they get it, as opposed to leaving their house, leaving work, taking their family to the doctor. And a lot of things that people don't consider is when men are work, majority of the families are at home with children. And they have to wait for the husband or the father to come back and take them to the hospital, wait there. Whereas you eliminate all of that when you have a consultation app at home. And it's also, you also know how your employees are doing. So, you know if they're having certain trends that you need to manage. We had a corporation who had a massive outbreak of COVID-19, and they never knew it. But because so many patients started coming out with symptoms, we had to blow the whistle and tell them, and they acted promptly on it. And this is just one case. Or one scenario. You can do that for so many things, for mental health, for nutrition, for diabetes, for hypertension. So just knowing your employees better, knowing them more closely, and making sure that they have someone at all times that they can talk to. I think that's something that really encourages a lot of corporates to use it.
Wow, that's very, very interesting. The insights you can get from that. And yes, and that's, the webinar we did, you also provided that's really good insights based on the data, where you were able to tell us what's the percentage of people who are calling you who have COVID-like symptoms. And people are saying on chat that they're also downloading and registering. So thank you, Dr. Sara, for all the wonderful work you are doing. You did mention that you are raising capital and you are done 60% for it. So if people have questions, follow-up questions for Dr. Sara, can you share your email address over here? And otherwise, you can reach out to me and I can connect you, or me or Tala, and we can connect you to Dr. Sara. And I think you're doing fantastic work. So keep it up and all the best for it.
Can I just add just 1 minute? But I really want to thank.
Please take your time.
I have a very good friend there, Modi Ali Shah Bukhari, who was in a very interesting fellowship with me last year. If you're there, hi. But I think it's not that of a site you see social impact conferences in the country. So thank you for doing that. Thank you for enabling all of us to pitch our work. I know not many people know about it, but it is because of platforms like these that me and Davai and Uptrade and all the cool people who are doing such great work, especially Furqan, who's been added. I have so many friends who are presenting their work today. Thank you for doing this for all of us. Thank you.
A pleasure. Thank you for saying that. And Mahmood is in Canada, but he will be watching the recording. So thank you so much.
All right. Thank you.
Thank you, Sara.